This is a basic tutorial for 3DRX Insight, and I'm going to just go over some different aspects of the program on a very basic level for a common user so they can become familiar with how the program works. It's very easy to use, and it's broken down into two components. One is the 3D side and the other is the rehabilitation side. First, I'd like to enter into the 3D side, and as I enter the 3D side, I want to point out that the animations are broken up into areas of the body. So for example, if I wanted to find a particular animation in the shoulder, I would simply click on shoulder and then choose something like infraspinatus tendinitis, and then the animation corresponding will play in a three-dimensional format. It'll show motion and inverse kinematics. It'll show the muscles that are relating to, in this particular case, it highlights the injury. And one of the nice features is that we've predetermined some markable images, and this is great for the touch screen. So you can just touch that image and bring it up, or any of the other images that are related to the animation, and then you're able to draw on that image and close that image, and it becomes part of your current session. And your current session can either be exported, or it can be emailed, or it can be printed. And that's just a great way to communicate with your patients. Let me show you one more example, and this of the basic feature of the program. So let's go into posture and just look at the C-spine kyphosis. So as you can see, the animation plays through, and at any point the images that relate to key stopping points and key areas of the animation, you can bring those up to highlight using your drawing tools. You can draw a straight line showing good posture, and then you can bring up another image and show how the forward head posture and straightening of the spine, and even highlight that the shoulders are rolling forward and that the chest is sinking in, and different areas of the body are being affected as your head continues to go forward. So with these different images, it makes a very good and detailed report for the patient to refer to. Again, once you have these images that you've drawn upon, you can export those, you can email those, or you can print those images. And that's the basic features of the 3D side. There's hundreds of animations to choose from, and we cover all the common conditions that you would see with the patient day in and day out. It's very helpful in the communication with the patient so they can quickly understand their condition and be able to own their condition by seeing the markings on the images that are markable. I want to also go into the rehabilitation side, because when patients understand what's wrong with them, their next question is, what do I need to do about it to make it right? So you can bring them into an area like, for example, here we have the shoulder highlighted because they're of a shoulder injury, and we can take a look at rehab ball exercises, flexibility exercises, balance exercises and stretches, resistance bands, floor, and weight. And so we can take a look at all these different categories and different exercises, and there are hundreds to choose from. So what we've also done is created protocols, and these protocols are customizable, so you can create your own protocols, but we got you started with a few. So if you wanted to take a look at a rotator cuff, and I'm going to open up that protocol, and you can see that protocol, once we open it up, it becomes our current session. And so with the current session, we can take a look at these different stretches or exercises. We can mark them up, as you see. We can add notes for the patient to refer to, and it also has a built-in explanation So you can see that the explanation is already there, predetermined, but you can edit that and see the beginning and ending position for the patient, and add that to the session with any of the instructions that you want to include. So now the current session, just like on the 3D side, now becomes what your report is based off of. So you can send an email and show that current session. You can print that current session, and I'll just give you a print preview of what that current session would look like as if it were printed out. So I'll click on print, and then you can see that there are instructions. You can change the sets, the reps, the weight, the holding and rest, and it will give you a description in addition to the beginning, ending position, and any markings that you've indicated or special instructions that you want to give the patient for their rehabilitation. It's a very quick and easy way to communicate with the patient, and you can just send that report via email by clicking send email and typing in their email address and then clicking send. So the rehabilitation portion of the program is very easy to use, and there are also advanced features to this area of the program that you should see the advanced feature tutorial to find out more about those.